Can I choose between a parallel or tapered crease for my Asian double eyelid surgery?
Double eyelid surgery, also called Asian eyelid surgery or Asian double eyelid surgery, is a very popular procedure worldwide. It's generally understood that about half of the people of Asian descent are born without an eyelid crease, which applies to people who are Chinese, Japanese, Korean, as well as other Asian ethnicities. It's often observed that the absence of an eyelid crease can make the eyes appear smaller and even look tired or possibly even angry. This means that double eyelid surgery can make the eyes look bigger and brighter. People considering double eyelid surgery become aware of the different types of eyelid creases. For example, the parallel crease is where the eyelid crease runs parallel to the eyelid margin of the upper eyelid. The tapered or nasally tapered crease, it literally tapers in towards the inner corner of the eye. Although most of my patients are interested in a natural result, I do find that it's helpful to show my patients the difference between these two types of creases and what my recommendations are for their specific situation. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in New York City and Long Island for over 25 years. I routinely perform all types of cosmetic eyelid surgeries, such as helping people who have under-eye bags and hooded upper eyelids. I also perform specialized cosmetic oculoplastic procedures such as eyelid ptosis correction. I'm well known for performing Asian double eyelid surgery, and as mentioned earlier, there are about 50% of Asians are born without an eyelid crease. Of course, this particular characteristic can apply to other ethnicities who have Asian features. Now, during consultation, I'll show the patient by using an instrument or a Q-tip and push back the eyelid skin where a natural crease would have formed if they had been born with one. Now, pushing the skin back this way also shows how the patient's natural anatomy would have determined whether their natural crease would have been parallel or nasally tapered. As far as a patient requesting a type of crease, in my opinion, forcing a type of crease that does not fit your natural anatomy can result in an unnatural looking crease and make you appear kind of plastic. Upon determining what kind of eyelid crease looks natural, the next step is to determine what kind of surgical procedure should be performed. Generally speaking, there are two types of double eyelid surgery approaches. There's an incisional or a non-incisional option. Incisional surgery is usually performed in the presence of excessive skin, fat, or a combination of the two. Younger patients in their 20s and 30s usually don't have excess skin or fat, so I usually perform non-incisional Asian eyelid surgeries for these patients. With this technique, small openings are made in the upper eyelid, so sutures can be passed through these openings in order to create a connection between the upper eyelid skin and the muscle that lifts the eyelid called the levator muscle. The area where the connection is made is where the eyelid skin folds when the eye is opened, thereby creating a crease where there wasn't one before. For older patients who have some eyelid skin laxity due to aging and some prolapsed fat behind the upper eyelid, some eyelid skin and fat can be reduced so that these patients can have a proper crease. Now, sutures are placed to close the incision, and like the non-incisional approach, the incisional procedure, the crease is formed where the suture makes a connection between the eyelid skin and the levator muscle. I perform all my eyelid surgeries in my office operating facilities using local anesthesia with light IV sedation, thereby avoiding the risks and complications associated with general anesthesia. Most of my patients are able to return to work in 1 week or less with minimal swelling. So although it's possible to pursue a nasally tapered or parallel crease by choice, in my opinion, it's better to work within your natural anatomy so that the eyelid crease you have after surgery appears natural and consistent with your facial features. I hope you found this information helpful. Thank you for your question.